Hi, everyone. Welcome to the show. In the field of care for poor circulation in the legs, known as peripheral artery disease or PAD, there exists a profound divide between those who see limitations and those who see possibilities. And today we are going to honor a physician who has dedicated his career to exploring what is possible when others might stop trying. Dr. Marco Manzi of Padova, Italy, has built his practice on a simple yet powerful philosophy. If a patient is already facing amputation because of PAD, because of those blocked arteries in the legs, then why not try? Why not try to open them up and restore blood flow? This approach has led him to develop pioneering techniques in distal vessel revascularization that many once considered absolutely impossible. What sets Dr. Manzi apart isn't just technical innovation, though, but truly measurable results. His team maintains one of the lowest readmission rates for PAD patients in the region. Concrete evidence that going further to save a limb benefits the entire patient, the whole patient. Now, some may question whether his aggressive approach to limb salvage goes too far. But Dr. Manzi's response is pragmatic. As long as it doesn't cause further harm, the attempt itself has so much value. This philosophy has not only saved countless limbs, but has inspired interventionalists worldwide who have trained and been inspired in his lab, including our very own Dr. John Phillips. Now, Dr. Manzi doesn't just perform procedures, he truly transforms standards of care and challenges our collective sense of what is possible in limb preservation. That's why Dr. John, I think you're going to agree that Dr. Marco Manzi is well deserving of the Global PAD Association's 2025 PAD Lifetime Achievement Award. He is the recipient. Dr. Manzi is incredible, and he's still so young. So to say he's our Lifetime Achievement Award winner and he's yet so young, it just shows the profound impact that he's had already in his career.
100%. I can't think of a physician and a friend who's more deserving. He truly, at least in my opinion, has pioneered some techniques that have saved a lot of piggies and a lot of limbs. I can accredit him to helping develop my career, and we'll probably get into this. But about 11 years ago, I spent 5 days with him and Mariano, and they really opened my eyes to what were options and techniques to help people, particularly with the blockages in the vessels below the knee. So it's an honor to have a friend on the show from across the pond, and I know it's a little bit late there tonight, so I'm pleased as punch to have you, Marco. Thanks for joining us.
Thank you, John. Thank you, Kim. I'm really honored to be with you, and um, it's a surprise, but it's really a pleasure to know that at least something in my job um, has been useful for not only for patients but for colleagues, for many physicians who visited me, and listening to John and. Mm, yes, I know he is now is completely different from 10 years ago, of course. And if I could change something in better, very few, I am happy for this. So thank you, John. Thank you.
And
And
I'm
this is
curious, Dr. Manzi,
one
going
purpose
way
of my
back
life.
in, aw.
I
I
it,
guess you're just beaming, John. This is like the best moment in the entire world. I can tell the impact that he's also had on you and your career. And I'm curious, before I ask Dr. Manzi about his defining moment where um, he realized that he needed to push further. He needed to develop new techniques? Like maybe there was one patient that led him to go, whoa, I just can't give up on patients. I'm curious from your perspective, Dr. John, the aha moment you had in his laboratory, which gave you that confidence or gave you that additional extra oomph to say, I'm not giving up on these patients. I can go further. If they're facing amputation, then why not try?
Well, I mean, when I went over there, I was about 2.5 years into practice, and really maybe a year into feeling comfortable doing some of this vascular work. But I didn't realize, it's like the I forget who. There's a French philosopher that was quoted as saying, the eyes see what the mind can comprehend." And so for me, it was kind of like I didn't really know what I didn't know, and so I go over there and into their hospital, small-ish cath lab, and they're doing is just treating all these folks that had very similar lesion patterns, and through that had very refined techniques using minimal equipment, and that is something that was just interesting to me as well. I mean, they really understand how to use a simple balloon and a wire, more so than some of the stuff we do. But just I remember we were doing a case and Marco wouldn't give up, and I'm like, at this point, we had a rapport together, and I was like, Marco or Dr. Manzi, when do you quit? And he's like, failure is not an option. And when he said that to me, I thought, okay, we can keep pushing this. We're not going to hurt this patient, and they are staring down an amputation, so we've got to keep pushing, and this is going to be okay. And we were successful, and I've taken that little nugget and locked it away in the old mental Rolodex, and that comes out pretty frequently in my practice.
So Marco, when in your career did you have that aha moment that failure is not an option?
So I remember in this moment, the first time I decided to do something really off label. I mean, again, a young patient, diabetic patient with a terrible um, gangrene of the forefoot, with a very complex vascular situation, and I failed twice with this patient. So the day before the major amputation, not the vascular surgeon, the foot surgeon told me, "Would you like to try again the last time? Otherwise, I proceed with the major amputation." So I thought to myself, okay, I spent almost 4 hours with this guy, and I had two failures. Okay, let me try again, and you know, something could happen different. And during this third attempt, I thought, well, I cannot go antegrade. I cannot go retrograde in the normal fashion. And I thought, okay, I will try to perform a retrograde puncture of the digital arteries. So it was the first patient in the world receiving this approach. And I was with Mariano, and Mariano, I still remember the eyes of Mariano when I said, okay, let's go through the digital arteries. He watched me like, are you crazy? Are you joking? Uh, but we did it, and we succeeded. And that patient still walking on his leg after 12 years. So we checked him July last year for the other leg, and only a transmetatarsal amputation. So I think that, yes, sometimes it's funny because things happen when you uh, when you are not waiting for that event. So why not try again? This is my philosophy.
Thank you, Marco. We have to go to break. Stay with us. Continuing conversation with Dr. Marco Manzi. We'll be back in 2 minutes.
How many procedures are you willing to go through? Is it worth going through that many, or would you rather just cut the leg off?
That's funny. Was it worth it? Oh yeah, I have my leg, man.
Amputation should absolutely, positively, 100% never be a first-line treatment.
What an incredible operation. What an incredible lab you have here.
Without a doubt, we're underdiagnosing peripheral arterial disease. It has not gotten the attention that it should because it is a killing disease, it is a disabling disease, and most importantly, it's a disease that we now have great treatments for.
Okay, let's go to the next one.
They were going to amputate it, and I needed to consult with my family. Did I want it off here or here? You're just shocked. It's scary. I don't even know how to explain it. You're 42 years old.
We're waiting till people are at the end of the spectrum and almost beyond hope. There is good care available here. Closed minds are what we have to get rid of.
Welcome back, everybody. Thank you for joining us. We're honored to have Dr. Marco Manzi in Italy speaking with us today, and we only have you for a short time during this radio show. But Marco, I wanted to ask you, we've talked about it and touched on it, but you've pioneered some techniques that have helped people save their limbs. You've helped physicians around the world. And kind of altered the course of many careers, including mine, and we're thankful. But that's a lot on your shoulders. That's a lot to balance, and I know you have a family. Can you talk a little bit about, number one, what continues to drive you to treat these folks, and number two, how do you balance that drive with the outside forces that exist, and the importance of being a family man and a good husband and father?
Okay. Yes, of course. I'm a husband. I'm a father, and I have tried in my life to balance working related events with family. But of course, I'm lucky because my wife, she's a nurse. My wife has been a nurse in the cath lab with me in the beginning of my career, so she can understand perfectly my feeling and my approach. So without her, of course, I could not reach any of the targets I have reached during my career. I have to thank her a lot. The same with my daughters. I have 4 daughters, not only one. I have 4 daughters, and so
A lot of weddings.
Yes, I try to give my best in the family too, of course, but sometimes I realize that probably you can't say always the true when you promise to respect a time for a dinner or for particular event. This is said from a point of view, but this is a part of the game. Everybody of us knows that we are not doing an employee job, so there is no time in the beginning, no time in the ending, and no breaks, no. Okay, it's not a normal job. Probably
No.
it's more similar to a mission in the in the romantic view of the medical profession. Sorry, I forgot the first question.
Well, it's more about, you give up so
Me
much.
too.
I love that you say it's a mission, right? But I think the first part of it was there are a lot of doctors still out there that likely would believe that you go too far to try and save a leg, that you set a bad precedent because you, as doctors, interventionalists especially, are putting your lives on the line for the sake of someone else's limbs. Because many of these procedures can last hours with intense exposure to radiation. And I know Dr. John has told me where he wanted to quickly get in and save this leg so much. He started with the antegrade approach with access at the groin going down. And he couldn't even wait for them to switch the radiation protection. And he was already looking for access to try and come up from the bottom for another, different angle on tackling the blockage. You really get focused on it. So, what sort of resistance have you faced and how do you address it?
Well, the aggressive procedure, I always tell people that you have to be aggressive with good sense. Good sense means that when the patient needs, when the clinical situation needs to be aggressive, you have to be aggressive. If you are not aggressive, probably you can't really help that patient or that clinical situation. But to be honest, the radiological exposure when you go antegrade is very, very low, especially if you have to work in the foot or in the tibial vessel. So the flat panel is very far away from your eyes, your hands, and your head. And I tested, and there are no radiation below the apron. The problem is when you have to approach a patient from the foot. So in the retrograde fashion, you have your hands and your body, your head very close to the flat panel, at least during the first phases of the approach. So during the puncture, during the wiring manipulation to put the wire in the vessel, then you can you can find a good position. So again, the probabilities to receive a high exposure are very low. But in the beginning, so that's why it's very important to try to give your best during the formation, because if you are skilled, if you become skilled, you reduce the time you need to be exposed because you are faster and you are you are sure to be successful. So it's only a question of experience. That's why I really believe in the formation. This is one of the basic rule of the click meeting. So trying to give information, try to show and try to help people to be skilled in the shortest time is possible. That's very important. That's why in the beginning, I think probably 15 years, 20 years ago, the percentage of retrograde approach in my lab was less than 3%. Now is more than 45%. Why? Because now if you fail antegrade, you immediately you shift to a retrograde approach, because you know that it's very short time in a very fast way you will achieve the vessel from below, and this is only due to the experience, to the number of procedure we have. That's all. That's the rule, the main rule.
So describe a case that you learned a lesson from that other physicians and clinicians can actually learn from. It could have been a success, it could have been a failure, it could have been early on, it could have been recent.
Okay. Yes, immediately I remember a patient with, of course, a diabetic patient with PAD, with a very complex multi-level long occlusion, more or less from the groin to the foot. It was really, really complex, occluded, calcified. So it was in the middle of the afternoon, and sincerely, I was in a hurry because at the end of my day, I had my gym. I'm trying to maintain myself in good shape. I have to leave because my last daughter, she's only 8, so I had to survive. But despite all my efforts, all my technical tricks, after 2 hours, I could not succeed completely. So I decided to give up, and of course, it was a little bit sad. But the patient told me, "Thanks, doctor. You did your best." But after 10 minutes, I spoke with the foot surgeon, and the surgeon told me, okay, if you failed, I will bring immediately the patient in the theater, and I am obliged to perform a major amputation, high in the thigh. And I felt myself, you know, how stupid you are. I am in a hurry for my gym, and for this gym, I let this patient lose a leg. So I stopped the patient during the the transport between the cath lab and the theater. I stopped him, and I brought back in the lab, and I started the procedure again since the beginning with a double approach, and I succeeded. So at the end, the lesson is that probably the first success starts in how you prepare your mind. If you, it's difficult because everybody of us has a personal life, has his own family, but sometimes in our job, patient really comes first. So we have to moderate our hurry, our desire to end the day, and be available to spend time enough to try to do our best. This is the lesson.
Share the most defining moment in your career. What we call the 6 minutes that matter. It could have been a conversation you had, a scene, or in a movie or a documentary, patient, a mentor, something you observed, but something that created an inflection point in your career, a catalyst for change, a defining moment for you in your career.
Well, I think that many years ago, I think probably almost 20 years ago, I met in a congress. I was very, very young, but completely unknown. and I really didn't yet know so much about my technical tricks and my techniques and my approach to this diabetic patient. So in a congress in France, for the first time, I met Frank Witt. Frank Witt, I didn't know who Frank Witt was. So in the middle of the people listening to my presentation, there was Frank Witt. And when I finished my presentation, I showed a case. I didn't realize that my case was a little bit different from the average cases of those years. So Frank didn't believe in the reality of that movie I showed, and he told me, "This is fake. You did with Adobe Photoshop." So I was terrified because and I thought, oh my God. So I told him, sorry, professor, if you want to spend 5 minutes with me, you can sit down, and I will let you see in my PC the hundreds other case I have. And he sat down with me, and he checked all the movie I had in my PC. And since that moment, I have been invited as faculty in VIT Symposium in New York, and I understood that probably I was on the right path. So I decided to move on and to continue in my attempt to give something to this discipline. Okay, so
That's an amazing story.
Marco, we're coming up on the break, and I think we have to say goodbye. But I will just say that it amazed me the ability that how you developed your techniques with just minimal equipment, and it taught me to be efficient. And like you said, the more you do, the quicker you get, and then the cases aren't as long, and it's just very rewarding. And I just want to thank you on behalf of Kim as the Lifetime Achievement Award winner. You're a hell of a guy, and I hope to see you at Click sometime soon. And we really miss you, and we appreciate everything that you've done.